finished this. I'm just going to start this one. Comfortable? Okay, cool. So in doing the sideline, again, you want to make sure that we got everything and that they're up on their side, not move forward. So after working the arm, and if we ended, however, whatever stretch, I do believe, thank you, that you want to turn like this. So you're like this, turn like this, and you proceed with just a nice compression into the side. Compress into the side. And then you're going to come to the floating ribs and the iliac crest. And you can do something called dragon's mouth, which is an overlapping of your hands in this position. And you'll be able to go right into the soft tissue here. So inhale, please. And on the exhale, just sink down in. Pressure's okay. It's a really nice way of working the soft tissue. I mean, after you loosen it some, you can also use your thumbs to go in here, and you're going to come into the lateral properties of some of those lower, deeper postural muscles. As you work from the spine out, from erectors, you're going to hit multifidus, and then you work out a little bit more laterally and deeper, you'll get quadratus lumborum. But nonetheless, you're going to continue now in the compression of the hip. So I'd just like you to move down, and what I've been doing recently is coming like this to support the hip. Because if you compress here, a lot of times you might get some movement that way. So you want to try to keep the person up on the side, and this, so you're contacting the sacrum here, and you bring the leg around and stabilize, but it also brings your hara right over the work. So one of the easier ways of working the hip in this position is to make note of bony landmark here, in this case the greater trochanter of the femur, and then the lateral border of the sacrum. So all through here in the soft tissue, in a crescent moon shape is what we're compressing. So you can utilize the palm of your hand, and your fingertips just stay right on the greater trochanter, and you can work around in a circle. Leaning in, just nice compression.
Are you pushing down and coming in a little? Or are you just going
Just pretty much down. Pressure's okay, so. So you just compress depending on the tightness you're feeling. And then you can go back thumb on thumb and go in the same area. So, you know, you're going through all the soft tissue, so you're going through bellies of the medius. Are you paying attention to? Yes. Okay, good. And also to into piriformis. And then after that, you can use your forearm just to come down and lean in a little bit more. Okay. And then just continuation right down the iliotibial band. Now, a lot of times I'll anchor the sacrum with this palm of my hand, and I'll just continue here, because just when you press that way, it continually opens up this area. And here on this lateral side of the leg, you're working one part of the gallbladder meridian. And this whole sideline technique is all basically gallbladder, which starts here and it zigzags all through the temporal area, and it comes down to the shoulder and in front of the shoulder and right through the lateral side of the body and right through the hip and right through this iliotibial band to the knee. And then as you continue the compression, you're compressing in the lower lateral compartment of the leg into the peroneals. And again, any position that allows you to lean in with your body weight. And just to include this source point here, in front of the lateral malleolus. source point gallbladder. Sarah, how's that feel?
Good.
It's dull, ache?
Yeah.
Sorry for you. And from here it goes right into the dorsal surface of the foot and right out the second toe. And then you're going to continue your compression with the lines up the leg. So in this position, you can include, if you haven't already, the source points of the yin meridians like we covered last time. The source point for spleen, the source point for liver, the source point for kidney, the source point for liver, for kidney. And then you want to take the compression and you're going to compress through the soft tissue. Again, these three lines coming up. Now, how you compress, check out different ways. I mean, you could use the palm of your hand this way. Pressure's okay, sir? But what I'd like you to consider is how you stand. I believe this is called diamond stand. So this way, your hara is, try to keep it as over your work as much as possible so you can let yourself come from your center. Now, very light compression into the side of the knee. And immediately above the knee, you don't want to apply a lot of deep pressure because of the tendinous attachment of the adductors. But as you come up, you want to move so that you're centered. And then you can use various compression tools. You can use the palm of your hand. You could use the arch of your foot. You can use this lower portion of the knee. Whoa. And then also just your body weight. And her hip is conveniently here for your arm. Very nice. So in Thai massage, they talk about blood stops. And basically to put up some sort of supportive stop for the blood so that when you do finally release it, the back pressure causes it to go in and cleanse and open up the channels of the body. So from here we're going to do a stretch. So however you choose to end this by whatever compression, you want to grab a hold of this ankle and come down like this. So you're just finished compressing. You're here. Grab a hold here and look at how I'm pivoting, just like this, supporting the lower back. And this leg is slightly up, and you're just going to bring the leg back like this. You want to try to keep the leg as parallel to the mat as possible. So as you get it on this other leg, you shift grip so that two hands are like this. So now it's all about your body weight going back and your consciousness on how you're using your breath. So you like to inhale, please. And on the exhale, you just lean back, take up the slack. Is that okay, sir? You want any more? Not just, okay, you're fine. So that's fine for her. So you want to hang out there, though. You know, we talked about how these lines of energy, these meridians, are embedded in the connective tissue. So, and since they're water soluble, the viscosity of the connective tissue reacts to sustained pressure, sustained stretch. So, and in coming out of this, and this is just one of many ways of doing this stretch. Okay, of coming out of this and transitioning back into supine. Slowly release, and we just come back on one knee, and as we come up, we use the leg as a lever to bring them back into supine. So that's suave, this transition. Okay.